Hello, Clem.
Hello.
What can we do for you today?
Well, I've been told I've got an abnormal diabetes blood test.
Oh my goodness. Okay. So, yeah, I can see that looking at the computer. You've had a test called an HbA1c done. And this is a clever test that reflects what your blood sugar has been doing over the last 3 months. Diabetes is over 48. Normal is below 42. There's a grey area in between. You're not quite normal, Clem. Okay? Your blood test result was 46. So right in the middle, so I can tell you you're not diabetic today, but you're not quite normal. Now this is important because if we do the right things, or if you do the right things, you can stop yourself becoming diabetic further in the future. And that's really important because we don't want you to become diabetic.
Right.
So, if you could exercise a little bit more than you're doing at the moment, if you could perhaps use that to lose a few pounds in weight, and if you really look at your diet and try and cut out the sugary sweet things, that will make a difference. If we repeat your blood test then in about 8 or 12 weeks, we don't want to do it sooner than that because we'll still be looking at what you were eating last week or the week before, and we'll see whether that's made an improvement. Okay?
So I have to go away, try and do a bit more exercise.
Yep.
Eat less sugary foods.
Yes.
And hopefully lose a little bit of weight in the process.
If you could, that would be fantastic.
Come back for a blood test in 8 to 12 weeks.
Yeah, and if you do those things, I'm sure this blood result will get better and we can prevent you heading on to diabetes.
So do I just make those changes for 8 weeks?
No. This is a warning for the rest of your life, and if you make those changes and we can do the blood test, that will show how it's improved. But it's really important that you start to make these changes for the long term, for the rest of your life. If we heed the warning, it's going to lead to a healthier, better life for you. If you need further help with your diet, particularly for older people, we can refer you to our dietitian, works in the PCN. For those people below 80, there's actually a national program called the Healthier You National Diabetes Program, which is largely online, and so they can give you all the advice on that. And there are other various online resources that we can put a link to as well if you want to look them up.
How do I get referred to this national programme for offering
If
advice?
you just contact the surgery and say that you'd like to do that, we can make that happen. You don't even need to come and see a doctor or talk to a doctor for that.
And then they will contact me directly, is that?
They will.
And this result, what does it mean for the future for me?
It just means really that you're at risk of developing diabetes. We don't want you to become diabetic because that increases the risk of heart disease, strokes and all sorts of other metabolic complications. So it's a warning sign for you really, and if you make those changes you can stop all of those things happening. So that's why it's really important.
Fantastic.
Cool.